so excited to have here in the studio Dr. Mark Jensen, a plastic surgeon at Central Utah Clinic. Mark, how are you?
I'm doing well. Thanks for having me.
Great. Thank you so much for coming to talk with us for Women's Issues Month. And so we're talking about breast cancer a lot of the month. And we brought you in today to talk with you specifically about what a plastic surgeon's role would be if a woman had breast cancer and how we would go about implementing those services for reconstruction.
Well, a plastic surgeon's role is key. And I like to see the patients right upon diagnosis of breast cancer because it's helpful for me to see where they're starting. I plan with the general surgeon for either mastectomy or lumpectomy and then reconstruction. And a lot of things can be done for reconstruction, whether the option is for removing the entire breast or just removing a portion of the breast.
Oh.
So I see those patients through the entire process.
Okay.
So I meet them before surgery. I operate with the general surgeon to reconstruct the breasts and make them look ideal. And then they have their other treatments if necessary, like chemotherapy, radiation. And then I see them through that whole process.
Okay. So would they do the chemotherapy and radiation prior to the reconstruction?
They would typically do it during the reconstruction.
Oh, really?
Yeah.
Interesting.
So we start the reconstruction. In the case of a mastectomy, we usually put an expander in. And the expander stays in through the chemotherapy.
Okay.
And then after the chemotherapy and radiation is completed, then we would exchange that out for a soft gel implant, typically.
Okay, that makes
or we
sense.
would do a flap, or we would do some sort of reconstruction.
Okay. Well, breast cancer, it's every woman's worst nightmare because, obviously it can be fatal, but also because it really affects your physical appearance. And a lot of women, some of my friends even, have really felt like some of their womanhood is gone because of that. And so what are some of the positive effects that you have seen psychologically as well as physically from reconstruction?
Well, I think you touched on a really key point. I kind of have a passion for breast cancer because I have an aunt who had breast cancer and I have a mother who has breast cancer right now. She's going through that right now. And if you think about it, if you got a diagnosis of colon cancer, say, they would go in through an incision on your belly and take out your colon, and that would be the end of it. With breast cancer, not only do you have a diagnosis that's life-threatening, but you also are disfigured. And a lot of the things that are associated with being a woman are taken from you, namely your breasts. A lot of times the ovaries and uterus are removed after breast cancer. You go on chemotherapeutic drugs that take away your hair.
Yeah.
The eyelashes are a big thing for women. And when they're losing their eyelashes, they've lost their breasts, they get out of the shower, they look in the mirror, they have that constant reminder.
Yeah.
And so I've really been passionate about breast reconstruction because I think it's the outward battle that is also very inward. And when they're able to step out of that shower and look in the mirror and be restored, that's part of the healing. And that really happens, it really makes the whole journey worthwhile for me.
Yeah, that's
even though it's very
beautifully stated.
difficult.
Yeah, well, what a nice way to be able to come through such a difficult situation and know that you're going to be whole physically and emotionally as well. So, so what are some questions that I would need to ask? Let's say I went through this process. What are some questions I would need to ask before choosing a plastic surgeon?
Well, typically a plastic surgeon, first and foremost, you want to make sure they're boarded by the American Board of Plastic Surgery. It's the only really recognized board for plastic surgery. There's a lot of other fake boards. The Board of Plastic Surgery is very important. Their training, typically you would get a referral from either a local provider or from your general surgeon. I think if you get a diagnosis of breast cancer, you should demand a consultation with a plastic surgeon before proceeding with surgery. And the surgeons that I work with here in Utah County, Jennifer Tittenser and some of the other surgeons with Utah County Surgical Associates, they will always refer patients to either myself or other plastic surgeons prior to surgery so that we can discuss options.
Okay.
And that's very, very important. You want a plastic surgeon who does a majority of breast reconstruction because it's tricky.
Okay.
There's a lot of things that can be done. There's a lot of tricks that can be done to make it look right. And you want a high-volume plastic surgeon.
Okay. Okay. But
breast reconstruction currently is about 70% of my practice.
Okay. So obviously I'm going to be calling you if this ever happens. And that's good to know that they need to be board certified. They need to have the majority of their procedures be breast reconstruction. Is there anything else that we should be looking for?
Well, I think also that anytime you're reconstructing the breast, not only is it surgery that's paid for by the insurance, but it's always cosmetic. In other words, what I mean by that is I'm always worried about the cosmetic outcome.
Yes.
And so I also do a lot of cosmetic surgery, and so I think my reconstructive practice augments or helps my
Your cosmetic practice?
my cosmetic
Yes.
practice. My cosmetic practice helps my reconstructive practice.
I see, because you have a very careful attention to detail,
Yeah,
and
you
you
want
want
it
to
to
make
look
sure.
right.
Yeah,
It needs to
you
look
do.
right.
You do. Okay, so in the news, Angelina Jolie is debuting her Maleficent movie today. So she's on my mind anyway because my daughter and I are going to go to the movie later. But it's very well known that she had a double mastectomy, a preventative double mastectomy. So tell me a little bit, why did she make that decision to do that? And can she come out of it looking normal?
Yeah, you know, it's a great question, and it's a thing that a lot of women choose. The idea behind doing a preventative mastectomy started at Mayo Clinic, where I trained, and I knew the founders that actually came up with that study that was published in the New England Journal of Medicine. They helped train me. What they do is they remove the breast tissue in hopes of preventing breast cancer, and with certain familial genes like BRCA and some other genes, the risk of breast cancer is around 90%.
Wow.
Throughout your life. And through a preventative mastectomy, we can reduce that rate down to less than 1%.
Wow.
And typically what we would do is make a small incision under the breast, remove the breast tissue. Many times we can save the nipple.
Wow.
And we replace that tissue with an implant. And many times they either look better or about the same as they did before surgery.
How interesting. So is the process all at the same time?
Typically what I would do is we could go underneath the fold of the breast, make a small incision, take out the breast tissue, put a tissue expander in, which is a inflatable balloon. And then we would inflate that over time until the patient had the desired size and shape.
Okay.
And then the second operation, we would go back through that same incision, take out that water balloon, so to speak, and put in a silicone implant. And I would also do liposuction and transfer fat into the upper chest and around the breast to shape the breast and make the breast look right.
Oh, wow.
And so it's great. It's a win-win.
That is a win-win.
And if you can prevent cancer, that's great. Many of those patients also need their ovaries removed because some of them are high risk for ovarian cancer as well.
Interesting. Wow. Well, thank you so much. I learned so much today. That was really cool.
Good.
All right. Well, it's nice to see you, and thank
Thanks.
you so much for being here.
Appreciate it.